Welcome to the Baseface Network.
Hello everyone, let me introduce myself. My name is Aisha Leilani Vania Pasha from the D4 TLM study program. Here I will discuss TB disease. Tuberculosis is a communicable disease which is caused by a bacteria, Mycobacterium tuberculosis. The disease mainly affects lungs and cause pulmonary TB. It can also affect other body organs such as intestine, meninges, bones and joints, lymph glands, skin edge, which is known as extrapulmonary TB. Tuberculosis. The disease is usually chronic with different clinical manifestations. The disease also affects animals like cattle. This is known as bovine tuberculosis, which may sometimes be spread to human population. Causative agent of TB. Tuberculosis is caused by bacteria Mycobacterium tuberculosis. The human strain is responsible for the vast majority of cases. The bovine strain affects mainly cattle and other animals. Source of infection. There are two sources of infection, human and bovine. Human source, the most common source of infection is the human case whose sputum is positive for tubercles. Bovine source, the bovine source of infection is usually infected milk. How to spread? Mode of transmission. Tuberculosis is transmitted mainly by droplet infection and droplet nuclei generated by sputum positive patients with pulmonary tuberculosis. It may also spread to vomitus. Incubation period. Incubation period is the time taken from entry of infectious agent to appearance of signs and symptoms. The incubation period of tuberculosis may vary from about 2 to 12 weeks. Signs and symptoms: fatigue, cough for more than 4 weeks with or without sputum, coughing up blood, low-grade fever, chest pain, and chills. Diagnostic investigation. 1. Sputum examination. Sputum smear examination by direct microscopy is now considered the method of choice. 2. X-ray examination. Chest X-ray are useful for the diagnosis of sputum-negative pulmonary TB and TB in children. 3. Sputum culture isolation of Mycobacterium for sputum sample by culture is very important for definitive diagnosis of tuberculosis. 4. Mantoux test. The Mantoux test is carried out by injecting 2 of ppd in 0.1 on the flexor surface of the left forearm, with the result of the test is read after 49 to 96 hours but 72 or 3 days is the ideal. Reaction exceeding 10 mm are considered positive. Those less than 6 mm are considered negative. How to prevent it? 1. Avoid direct contact with TB sufferers. 2. Use a mask. 3. Washing hands. 4. Throw away plague in a special and closed place. 5. Exercise regularly. 6. Add nutrition food. Here we usually see the TB graph in the years 2011-2013. In 2011, case detection was quite high. The Tejo Agung Health Center 28% and Ireng Mulyo 17%. From 11% health center health service facilities. The lowest TB case in 2011 were Yosodadi Health Center with 0% and Karangrejo with 0.4%. In 2012, highest number of cases was found in the Banjarsari Community Health Center, increasing by 195%. And 2013, the highest cases were found in the Tejo Agung Community Health Center and the lowest in the Yosodadi Community Health Center. And the last one is conclusion. The incidence of pulmonary tuberculosis sufferers is increasing every year. There are several reasons related to the increase in pulmonary tuberculosis sufferers, including the lack of public awareness in carrying out suspected sputum, lack of knowledge information in the public about the transmission of pulmonary tuberculosis, negligence in seeking treatment, so that as healthcare workers we must pay special attention to people who are exposed to Mycobacterium tuberculosis so that sufferers the number of TB sufferers can be minimized.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
That's all my explanation, more or less. Sorry. Wassalamualaikum warahmatullahi wabarakatuh.